Hello, I am Dr. Franco, Medical Director of the Arthritis Center of Riverside. I have over 30 years' experience in the field of rheumatology. There are over 100 forms of arthritis, including rheumatoid arthritis, osteoarthritis and spine disorders, fibromyalgia and chronic fatigue syndrome, scleroderma, lupus, inflammatory myopathies, and many others. I believe that infectious agents can trigger arthritis. In order to accurately diagnose our patients, we have an in-house high-complexity laboratory with a state-of-the-art instrumentation. We also use X-rays and MRIs. When we arrive at the proper diagnosis, we use conventional and alternative medicine in a complementary way in order to obtain best results. When I see patients with rheumatic diseases, I always want to remind myself that my purpose, and the purpose here at the Arthritis Center of Riverside, is to promote the well-being of patients. Now, patients not only have a body, but they also have a psychological aspect as well as a spiritual aspect, which is very important and all too often not considered. When we look at patients who have arthritis, want to determine what is the root cause. And the root cause, in my opinion, many times are microbial agents. These infectious agents can be viruses, and we know today that parvovirus B19, the human form of parvovirus, can cause an inflammatory form of arthritis that can be very severe and can produce joint destruction. There are other viral illnesses that also cause involvement of the joints. We have looked at different illnesses, including rheumatoid arthritis, where we have found that other microbes included mycoplasma. Mycoplasma pneumonia is one of them, but we have also noticed that mycoplasma pneumonia was not the most frequent strain of mycoplasma present in patients with rheumatoid arthritis. Other bacteria include streptococcus. They can affect the joints, usually not directly, but by extension. They produce inflammation of the heart, different components of the heart, different components of the kidney, as well as the nervous system. And thereby, we need to eliminate the initiating agent, which in this case is the streptococcus. It is important to determine for us what is the extent of the disease. So once we assess the case by laboratory tests as well as imaging studies, we have to focus on different aspects. Not just the infectious agents, but of course general chemistries, as well as special chemistries. In this case, because frequently patients who have chronic illnesses have abnormalities of the endocrine system. The hypothalamic pituitary adrenal axis may not be working well, and sometimes we can restore them. We can restore the adrenal function if we use the appropriate medications or nutritional supplements. So in order to determine the diagnosis, we have to use the laboratory, and we here at Arthritis Center of Riverside have a high complexity laboratory that has very useful tools. These are state-of-the-art laboratory instruments, and furthermore we use our digitalized X-rays, which are very useful in obtaining images. We can obtain the images from the patient and at the same time be transferring the image to the examining room where we can see what's going on, as well as the MRIs, which will give us an idea of what is going on inside the bone, inside the joints. Because the MRI produces a series of slices in different orientations, and it's like a 3D image. Once we have the diagnosis, of course, we need to treat the patient, and we need to address that in a way that is productive and safe for the patient. That's why we try to use non-toxic medication. We use natural medicine, we use nutritional supplements, and we also use conventional medicine. We are not dogmatic. We don't say never this, always that, because even the more toxic medications like immunosuppressants and corticosteroids can save lives and can be very useful at times. So we don't discard any tools, but we have to use them in a judicious way. It occurs frequently that patients who are on immunosuppressants and corticosteroids, after a while, we're able to decrease the dose and sometimes discontinue that and replace that from the outset with nutritional supplements. Now, we have to stay current always. Recently, at the national meeting of the American College of Rheumatology, there was a paper presented. The opening lecture was by Dr. Jerry Weissman from New York University, a very well-respected rheumatologist who gave a lecture entitled Porphyromonas gingivalis, a microbe from the gums that causes gum disease, causes rheumatoid arthritis. And it's interesting that it's coming to the mainstream. I have said for many, many years that multiple infections can cause different rheumatic diseases depending on the genetic susceptibility. We also have to be aware, as I said earlier, that there is a connection between the body and the mind and the spirit. And if we're able to address that, patients will have a better experience and our treatment will have a better outcome. Let me take you on a tour of the laboratory. Our first instrument is a hematology analyzer, where we can detect different cells, including white cells, red cells, and platelets. Our next analyzer is a chemistry analyzer, which allows us to determine how the internal organs are functioning, as well as cholesterol and other lipids, immune function, as well as streptococcal antibodies. Our next instrument is for special chemistries to detect multiple hormones, including thyroid, adrenal function, and others. This instrument allows us to detect autoantibodies that identify multiple rheumatic diseases as well as infectious agents. As most of us know, radiology is very important. Our X-ray machine is digitalized and delivers less radiation. We obtain very precise images, and we can zoom in or out, and therefore it's like a magnifying lens that allows us to see more precise detail and arrive at a more precise diagnosis. While patients are at the Arthritis Center of Riverside, they can have MRIs of the peripheral joints. MRIs complement the X-rays and gives us precise information about what is going on inside the joint. The purpose of our practice is to promote the well-being of patients. And patients as a whole have problems which are physical problems, sometimes psychological problems, and diseases can be overcome or improved from the physical standpoint, the emotional standpoint, and many times there are spiritual benefits that occur with the overcoming of the illness or the process itself of the illness. My patients tell me that their awareness of themselves and everything that surrounds them becomes clearer once they go through the process of illness. And there is a sense of gratitude of going through that. One might think, well, there's a lot of suffering with the disease. Yes, there is suffering, but there are hidden benefits as well. Furthermore, we have a private label of nutritional supplements and other nutritional supplements because we feel it's very important to use alternative medicine in a complementary way to be able to improve the effect of some prescription medications. Our first choice is always complementary medicine, assisted by the conventional medicine if required. We find that in that way, we have a better success.
I had a real bad scleroderma crisis, kidney crisis, caused congestive heart failure and total renal failure.
I got a vicious case of rheumatoid arthritis.
I got a nerve injury at RSD, and that caused fibromyalgia.
I couldn't even drive anymore.
I was in a lot of pain. I was in pain all the time.
A lot of people didn't think I was even going to live.
Dr. Franco's therapy and everything has really turned everything around for me.
The first month I felt better.
Believe this, he saved my life.
He's great. He's great.
He's made the difference between, hope and no hope.